Wave of the pandemic for about a month with over 400 fatalities, Nigeria is now witnessing a slight decline in the number of confirmed cases of the coronavirus. However, precaution is still the watchword.
The dreaded third wave of COVID-19 may appear to be leveling and not giving the catastrophic figures that we saw. And we have not had catastrophic increases in infections and fatalities as we saw in some Asian countries. But it is not wise for us to assume that the threat is gone, especially since new cases as recorded are fluctuating, and many have been identified or have to be identified by genomic sequencing. Evidence so far, however, is that the Delta strain is already the dominant strain in Nigeria. So we must keep our protective measures in place and increase testing to determine our situation.
And as the country prepares for the reopening of schools, will school environments be safe for the children and the teachers?
Children are going back to school. Schools are reopening. School owners, principals are having to deal with the situation of taking responsibility for students, pupils, who might get infected, might spread the virus, and they have to take control. First, it's important to be aware that children are not immune to this disease, can get it as easily as anyone else, can spread it as easily as anyone else, even if they themselves don't get generally severely ill. But they are very good spreaders of the virus. The second challenge is when they do get ill, they don't present the way most adults present. They don't present very commonly with shortness of breath or with severe fever. They don't tell you they have lost the sense of smell or taste. They present with very unusual, normal symptoms that is very difficult to distinguish from a common cold, from what we call malaria. And if we as parents, teachers, caregivers don't take this seriously, they'll go ahead and spread. And we've seen instances of large outbreaks in schools that have gone completely unnoticed till one person is found positive, then we start testing and we find out that a large population of that school is positive. Yes, even if they may not be severely ill, they are likely to present that virus to parents at home, teachers, guardians, all of whom may be a little bit more vulnerable than them.
With over 70% vaccine utilization rate and the country expecting over 52 million doses of vaccines by the second quarter of next year, Nigeria is on its way to achieving herd immunity.
A total of 1,692,315 eligible persons are now fully vaccinated, and we currently have a national average of 70.4% utilization of the 2,040,000 doses of Moderna, or 2,040,000 doses of Moderna vaccines that we targeted to deliver to about 2 million people. As you are aware, we have reopened AstraZeneca administration as first dose to eligible persons 18 years and above who have not been vaccinated. I want to reiterate the need for those who have taken the first dose of the AstraZeneca vaccine to go ahead to the nearest designated health facility for their second doses.
Nigeria had in March suspended the operations of Emirates Airlines after the carrier imposed additional COVID-19 test requirements on passengers from Nigeria. Dialogue is currently ongoing to put an end to the impasse.
We're at unusual time, yes, but unusual time demands unusual solutions and unusual consideration to the plight of the 200 million people in our country. So the good news is we will continue the dialogue. They wrote us letters upon letters upon letters. So for starters, The bilateral air service agreement between the two countries is between UAE and Nigeria. And the Nigerian Civil Aviation Authority counterpart is the UAE Civil Aviation Authority, not Dubai. That said, if we will be receiving from any legal entity the statement to the effect that they have removed the 2 weeks rule, we are good to go. And it should be copied us and directed through the Ministry of Foreign Affairs, through the protocols.